This is brutally honest advice for healing a meniscus tear without surgery. Number one is quad muscle strengthening only makes the problem worse and it doesn't help the problem. If you look at the bone model right here, this is the knee joint right here in the front. There's the kneecap. The thigh bone is right here. The shin bone's right here. And here's your meniscus, this bluish thing. You have two in each knee and it goes even into the back of the knee. When you strengthen your quad muscles, which are right here in the front of the thigh above the knee joint, all those muscles attach to the kneecap through this tendon, and because the tendon turns into a ligament as it goes down from the kneecap to the shin bone, the stronger those muscles get, the better they pull. They pull up in this direction and it pulls the shin bone up into the thigh bone. And if they're really, really strong, that means they have an increased resting tension, which is big words for at rest when you're sitting around doing nothing. You're having a meal, you're watching television, you're watching YouTube, whatever it is, you're lying in bed trying to sleep. That muscle's doing a little bit of a pull and it's pulling your shin bone up into your thigh bone, smashing the meniscus right in the middle. So it doesn't make sense to go strengthen your quad muscle. Don't do that. Number two is hamstring muscle strengthening feeds into the same thing. So if you think about the hamstring muscles, they're on the back of the hip. You might be able to see them better right over here. They start right here on the bone where you sit in the pelvis, and then they run down into the knee joints and they attach to the sides of the knee joints on the bottom part of the knee. So they cross the knee joints. So if you go strengthen your hamstrings, because those hamstring muscles come down and past the knee joint, they're also going to pull and have an increased resting tension and be yanking the shin bone up into the thigh bone, smashing your meniscus in the middle. So it just feeds into the pressure on the meniscus at rest. We have this thought that you need to be strengthening your quads and your hamstrings because that strengthens your knee, and it does. It strengthens the amount of compression, the amount of force going through your knee joints, which is squashing your meniscus. Number three is MRIs aren't the full picture. And people often go get an MRI to look at what's happening inside the knee joint. They're looking at a tear in the meniscus. And oftentimes they'll find one, and then the surgeon's gonna say, well, that's the source of your pain, and let's cut it out. At least that's how the thinking has predominantly been in the past few decades. It's kind of starting to change at this point where they're realizing that the meniscus tear isn't always the source of the pain, and that the meniscus tear doesn't always need to be taken care of surgically. More on that later on this list. But what I want you to know about the MRI is if you get an MRI and there's a tear, that information gets burned in your mind, especially if you see pictures of the MRI and your surgeon or whoever, whatever doctor is doing this MRI, and they're highlighting it to, they're showing you and circling the tear on the image of the MRI. That information is just, it traumatizes you. You need to ignore it because it's very possible for you to have a torn meniscus and have no pain. It's possible that that meniscus was even torn before your knee pain started. We know this in research that people have torn meniscus in their knee, they have cartilage damage, they have torn labrums in their shoulders and their hips, they have discs that are damaged in their spine, yet they feel fine. So that means it's possible for you to get over this pain if we can find what the real source of the pain is and still have a meniscus tear as visualized on the MRI, and you'll be all right. So don't hang too much weight on that MRI image. Number four is that a muscle imbalance is the root problem of a meniscus tear. Now, I like to draw this out because they're pretty complex topics, but I make it really simple for you with this picture. Check it out. Let me draw you this muscle imbalance concept because it's just much easier to see rather than me just describe it. Let me draw you a thigh bone here. There's your thigh bone, that's the end of the bone. And then here is your kneecap. Here's your shin bone right here. And it goes down towards your foot. So I'm just gonna write foot right here. I drew this kind of big so that you can see the meniscus. It sits right on top of the shin bone right about here. Whenever you have this muscle imbalance, then you have to think about the quad muscles that connect to the kneecap right here, and they're on the front of the thigh. And then you have this tendon that runs down from the bottom of the kneecap and it attaches to the front of the shin bone. And so when this quad muscle shortens and it pulls your thigh bone, your shin bone into extension, it straightens out your knee, in other words. And so what you have to also consider back here is your hamstrings are right here. They come from your hip and they go down onto the sides of your shin bone. When these two muscle groups get too strong, you have to think about the force of pull. They pull in this direction. So if they're stronger and stronger, then you're going to have more pull of the shin bone up into the thigh bone, which is going to compress that meniscus right here. So in order to take pressure off the meniscus, we have to stop using these muscles as much. And in order to do that, we have to look up in the hip at the glutes. If you can activate those glutes, then what happens is you better align the knee joint, but you also tell your quad muscles and your hamstring muscles that they don't have to work as hard. They can work a normal amount, which takes pressure off the meniscus right here. But the secret is in getting those glutes stronger. Otherwise, if you don't have good, strong glutes, then you're going to overuse your quads right here, and then you're going to also overuse the hamstrings back here, and that's just going to build up the pressure inside this joint. That extra buildup in pressure from the quad muscles and from the hamstring muscles ends up building the pressure inside this meniscus right here, and that's what builds the tear eventually and makes you an unhappy person. Let's fix the glute strength first, then you'll have much less compression through your meniscus and be able to save yourself from tearing it worse and needing any other procedures done. Number 5, glutes. Let's stick on the glutes for a while since we just were talking about that. Glute strengthening is so important for making sure that you take the pressure off your meniscus. And yeah, you eventually need to go strengthen them in the gym, lift some weights, get those glutes really tired so that they literally get stronger and thicker and they're able to do more for you. But before we get to that, there's some important steps. There's 3 important steps that I want to highlight for you so that you can eventually go strengthen them and be successful in healing your meniscus and avoiding a surgery. Glute muscle activation is often terrible in people with meniscus tears. There are 3 things that people fail to do with their glutes when they're trying to fix a meniscus tear. The first thing is they can't even activate their glutes. I mean, think about it. Right now, whatever position you're in, try to flex your butt muscles. Try to flex those glutes. Like I'm doing it right now, sitting. You could do it in standing as well. You can do it lying down. But if you try to flex your glutes and other muscles contract instead, like your thighs, those muscles flex instead, then you're not going to be able to fire your glutes whenever you go do a glute exercise. You're actually working out your thighs, which feeds into the muscle imbalance. So if you can figure that out first, how to get your glutes to just turn on, now you're one step ahead. But the second thing is now being able to fire your glutes, being able to tension them just like this without your thigh muscles taking over. So you can tension your glutes just like that and hold it, be able to contract it like this and not feel your thigh muscles work very hard or not at all. If you can figure that out, now you can better isolate your glute muscles when you intend to do a glute exercise. And then the third level of glute activation is being able to independently fire the right glute apart from the left glute. Some people, they figure that out really easy, but other people really struggle, and it's a big problem because you have to be able to do this in walking. If you can't individually fire the left from right when walking, then every time you walk, you're going to be contracting both glutes at the same time, and that's going to mess up how you walk and cause you to put bad pressures through your knee and your meniscus. So you have to figure out how to turn on your glutes first. You might already know how. But the next step is you have to figure out how to get your glutes to work apart from your thighs. And then the final step is being able to get them to work apart from each other. Once you've achieved those 3 steps, now you're ready to maybe start doing gym exercises with weights. So to summarize the glute activation steps that I just showed you is first, you have to be able to turn on your glutes. Many people can't even turn on their glutes. They actually turn on their thigh muscles when they intend to turn on their glutes. Second is be able to fire your glute muscles apart from your thigh muscles. Then third, you need to be able to fire those glutes apart from each other. So left needs to be able to fire independently from the right. If you can do those three things, now you're ready to go start strengthening in the gym. If you can't do those three things, you shouldn't be trying to strengthen in the gym to fix your meniscus problem, because you're going to feed the muscle imbalance by using the wrong muscles. Number 6 is you have to also get stronger foot muscles. Now, glutes are by far the most important, because I find that roughly 80%, my rough estimate as an expert and just my biased view, 80% of people are dealing with the glutes. That's the biggest fix that they can make first. But the foot is important, because if you can get stronger foot arch muscles, and what I'm talking about when I talk about the foot arch muscles, they're the muscles that curl your toes. When your toes curl like this, those same muscles send tendons that run through the arch right here and then up into your calf muscle, kind of the lower calf area, not the big meaty part of the calf, but the part right below that. Those muscles are responsible for holding up your arch, and if your arch is better stabilized, if it's not falling down, then it's going to post your shin bone up better. So when you're standing, if your arch falls down, your shin bone right here wants to come down, and then it makes your knee joint kind of go in, and that messes with your glute activity. It just changes the forces going through your knee joint, which is going to impact your meniscus. So getting stronger toe flexors, which is going to translate to getting a better arch, but you might have to actively, consciously raise your arches and learn how to do that while walking and standing and doing exercises. If you can do that, then you'll have a better shot at taking away every bad force from your meniscus so that you have the best chance to heal. Point number 7 is that the lower abdominal muscles right in here are also important for giving your knee the best chance at avoiding meniscus surgery. Like the foot below the knee joint, there's joints above and below, because it's a chain of joints and muscles that all affect the pressures on your meniscus. We need to improve the whole chain so that the meniscus pressure is normalized. The lower abdominals are important because they attach to the rim of your pelvis bone all the way on the front and to the back, and even to your lower lumbar spine, your lower back right here. And keeping stability in your pelvis here is important for your glutes to work from. So sometimes people have trouble getting good glute activation and getting the maximum output of their glutes for helping their knee because they don't have good lower abdominal activation. And oftentimes people will go work their abdominals, they'll do sit-ups and other abdominal exercises, but they'll miss targeting those lower abdominals, and they'll just feel it in the upper abdominals. And here's a little trick. The way you can tell your upper abdominals apart from your lower abdominals so that you can get feedback on if you're doing the exercise right is use your belly button as the midway point. If you put a finger on your belly button and cut yourself in half this way, above your belly button is your upper abs and below your belly button is your lower abs. You need to be targeting your lower abs. And if you've been doing abdominal work, or if you've done abdominal work in the past in hopes of helping like a back, a hip, or even a knee problem, and you haven't felt your lower abs get targeted, you're doing something wrong. There's ways to fix this. I talk about this here on this channel. Get those lower abdominals strong so that your glutes can work the best they absolutely can. Number 8 is learn to feel the right muscles burn. Just like I was telling you to target those lower abdominals, you can't just go do an abdominal exercise and expect to target the lower abdominals. You have to pay attention to where you feel the burn. Because if you're doing an ab exercise and it's burning above your belly button, then that's what you're targeting. That's the best way to know which muscles you're activating and using, because you feel the fatigue, the burn, the tiredness happen in those muscles. Same thing with the foot muscles. If you feel the muscles in the arch of your foot and the lower calf area, not the big meaty part, the lower area, then you're targeting correctly. If you're trying to do a leg exercise with the intent of focusing on your glutes and you don't feel your glutes burning during the exercise, you're missing your glutes. And you probably feel your quads and hamstrings work instead. People go on walks and they feel their thighs get tired, not their glutes. You're missing the mark here. And this is great information because you don't need anybody to tell you. You know. You don't need a physical therapist like me. You don't need a doctor to keep an eye on you. You don't need a trainer. You don't need anybody else to tell you. Yeah, they can help you with form, absolutely. I coach people up on form all the time. But what I always tell people is it ultimately doesn't matter what I say about your form, because how you do it and how that person does it and how I do it might all look a little bit different. But as long as we all feel the glutes working or whatever muscle we're intending to target, then you're on track. And you can have certainty that that's the way that you need to be doing it. And this is different than feeling muscle soreness, because you might feel soreness the next day or 2 days later. That's called delayed onset muscle soreness, DOMS for short. You don't need to worry about that. That's good feedback that you had a good workout, but in the moment, when you're doing the sets, when you're doing the reps, when you're doing the cardio exercise, and immediately after, like as soon as you stop and you put the weights down, or you stop doing the exercise and you feel the burn in the right area, that's the feedback that you're looking for to know that you targeted the right muscles. Number 9, cycling makes things worse most of the time. This is controversial because a lot of people with a meniscus tear get told, go get on an exercise bike, get on a stationary bike, or go get your bike that you ride outside and start riding outdoors and get a lot of reps, because that helps to heal the cartilage, the meniscus tear. And there's partial truth behind this, but there's a big problem that most of the medical field is missing. And let me explain this. When you get on a bike and you're pedaling, especially with higher resistance, or if you're going uphill or you're trying to go faster when you're on an outdoor bike, you're probably using your quads a lot, because most people don't explain how to use a bike as far as what muscles to work. You need to figure out how to make your glutes work while cycling on a bike. If you can do that, which not everybody can, if you can figure out how to make your glutes get more tired than any other muscle in your leg while on a bike, then cycling might be okay for you. You still have to assess and feel if you're getting better overall. But if you're cycling and you feel your thighs getting tired, it's not good. And here's the thing, you might not feel a big problem right then and there, right after you're doing the exercise. You might actually feel better even. And so it's kind of deceiving, because you just biked for 30 minutes, your knee was hurting before, and now it's improved and you can do some stuff. And so the feedback is, oh, biking helps. Being on the stationary bike in physical therapy or at the gym or at my house was helpful. But you're making your quad muscles stronger. Slowly over time, you're building up that resting tension in your thighs, your hamstrings too often, but usually it's the quads is used more during cycling. You're making those quads stronger and stronger, and over time they're putting more and more compressive force. And so what people end up running into is they feel fantastic after that bout of cycling, and then later on in the day, they're sitting having a meal, they're sitting watching a movie, and all of a sudden they get this ache and throb in their knee. It just came on out of nowhere. They were just sitting down. It's because of all the cycling you're doing, because you're strengthening your quads. You just didn't connect it in the moment. But that's what's happening. So you got to stop cycling, figure out how to make your glutes work right during cycling and in other ways. If maybe they don't even turn on for you, you need to first figure that part out. Then, only then can you get into cycling. But if you're that person, because there's probably 1 out of 10 that I've seen personally that just can't fire their glutes very good on a bike, then don't bike. Don't even bike. And if you can't figure it out today, just leave it for later. You can get back into it later on, but right now just get those glutes to turn on. Don't go cycling for exercises. There's other things you could be doing instead to help your meniscus. Number 10 is walking won't help at first. Similar to the cycling, you need to be able to use your glutes during walking. And it's typically easier for people to do this. I've yet to meet someone that I couldn't train on using their glutes appropriately to walk, but I've also yet to meet anybody who I first had with knee problems in here who could fire their glutes extremely well. In other words, most people have trouble firing their glutes when they have a knee problem. That's what probably led them into having a meniscus tear. So if you start a walking program, because most healthcare professionals will have you start this, they'll say, oh, you have a meniscus tear, you're trying to avoid surgery, you don't want that meniscectomy procedure done, well, start walking, get on the treadmill, go around the block, go to a park and walk, clock your steps, get an app and look at your time walking and start to increase the amount of time walking. But all the meanwhile, if you don't know what muscles to use while walking, if you don't know the mechanics of the muscles used during walking, you're going to feed into the problem. You're going to make your thigh muscles stronger. And you can prove this in yourself. If you just go for a short walk outside, go down the street, go in your home, sprint walk down the hallway or right outside your house, feel what muscles are getting tired. If you can't make it be your glutes, then you should not be walking for exercise. I would reduce walking to the minimum amount that you need to do to live and to work and do your basic things. and focus heavily. I would focus all your time on getting your glutes to turn on apart from your thigh muscles and independently from each other. All that stuff that I talked about with the glutes, because then, only then, after you figure out how to make your glutes work right and then move it into walking, then walking is going to be good for you. But at first, face value, superficially, just go walking for meniscus healing, bad advice. Stop doing that. Number 11 is the meniscus is designed to absorb pressure. There's some principles here that are never talked about when it comes to meniscus healing. And a big thing is that the meniscus right here, it sits between these two bones, your thigh bone and your shin bone, and it's designed to take pressure when you stand up. It's made out of cartilage. So as a result, it heals really slow. It's got a really low metabolism, which means healing is going to happen really slow, really low blood supply, but there's fluid inside the joint that can give it nourishment and allow it to heal as well. But in order to allow the meniscus to heal, you have to take pressure off and then put pressures on it at the right amounts gradually over time to make it stronger. Just think of a muscle. If you wanted a bigger bicep, what you would do is go pick up a weight and do this motion, because that's what the bicep does. And over time, do heavier weights and more reps probably. And you just build up like that, and eventually you get a bigger bicep. It's a similar process that happens in the meniscus, except you don't get a giant meniscus, you get a more dense meniscus that's better able to absorb pressures. But if you do too much too soon, if you don't give it enough rest, if you have increased resting tension in your quads and your hamstrings, and it's constantly compressing it, and you never give it a relief of that pressure, then that's when you get damage and injury. Just like if I told you to curl that bicep weight for an hour, you would strain yourself. You would get a muscle strain. You would push it so far that it becomes injured. It's the same thing happening inside your poor meniscus. You need to take some pressure off and then load it, begin to put some pressure on at the right amounts that it can tolerate, and step up gradually in order to get a stronger meniscus. Number 12, relating to that pressure, offloading is under-recommended in the medical field. And what I mean by offloading is getting on a crutch, using crutches when you have a meniscus tear. Even using a cane or a walker. Usually people are going to lean towards crutches because they're just kind of the easier thing to do. You can completely take all the pressure off your leg when you're doing this. But because it's a pressure absorbing tissue, the meniscus, if it's injured, if it's torn, if you currently have knee pain, it's swollen, get on some darn crutches. Just get off the leg. That gives it time to heal. If your skin was broken, it would make sense that you don't want to go rub it because it can't take it. Skin can take rubbing as long as it's not damaged. But if there's a cut and you'll bleed, you don't want to rub that. It's the same thing on the inside. If there's a tear, you need to let it heal. And you have to take pressure off. But what most people do is they keep walking. In fact, they get told to go walking for exercise to heal it. And that just aggravates the situation even more. You need to get the pressure off your meniscus. And the easiest way to do that is to get on the crutches, get a cane, get a walker, take pressure off. And it can be for as little as a week, sometimes several months. You have to figure out what's right for you based on how you're improving as the time goes on using offloading. Number 13 is don't focus on pain relief too much. And I have a list here of things that people will do for short-term pain relief. That's what I'm talking about. They'll do pain medications, injections, they'll rub on pain creams, dry needling, massage, even manual therapy, which I'm a manual therapist. And what I just want to make a point about with all these things is that they're short-term pain relief solutions. And I'm not saying don't ever do them. That's not what I'm saying. I think you should use them at the right times and in the right amounts so that you can kick off the long-term fix for your meniscus tear. The problem that I run into with people is they get stuck on doing one of those things for much too long. They're doing, for instance, they're taking pain medications for a long time, hoping that it's going to go away. I think they have a thought that it's going to improve to the point where they don't need to worry about the meniscus tear anymore, but that's not the job of pain relief medications. Their job is just to take the pain away for a few hours, maybe a day or two at most. An injection, same thing. People will have a thought that the injection is going to fix a meniscus tear, but it doesn't. It's just an anti-inflammatory and a pain medication injected right into the knee, and it's only taking away the pain temporarily, longer than if you take a pill by mouth, but it's still temporary. It's just a few weeks, maybe a few months at most. And then pain creams, that's just a few hours. Dry needling is something that people will do. They'll stick needles that don't inject anything. It's just for the purpose of the needle. They'll put that into the knee, and that can stimulate some healing responses, but it's only short term because it doesn't teach you how to move better. It doesn't teach your muscles to get stronger. The effect is only going to be for a couple of days, maybe a week or two at most. You still have to pair it with other stuff to fix the long-term problem. And same thing with manual therapy and massage, which you can kind of argue are the same thing, but there's some differences. But that is just loosening up soft tissues or the joints if we're talking manual therapy. And you might need to start there or have that be a part of the process, not necessarily for everybody, but it still needs to be paired with correcting the root muscle imbalance. Otherwise, you're going to be back in the same bad pressures in your knee joint and the same bad compression going through your meniscus. Number 14, surgery is short-term at best. I would kind of throw it in that list that I said before, but I wanted to highlight it apart because some people will think that if you get that chunk of the meniscus that's torn cut out in what's called a meniscectomy procedure, that's going to fix the problem. Even surgeons often believe that that's going to get rid of the pain and get you back to normal again. But what we're finding out is that it's not the case always. There's so many people that still have knee problems afterwards. They are predisposed to getting knee osteoarthritis. It can cause some bad stuff to happen later on because you just have less cushion, less meniscus in the joint, less cartilage in the joint. And so you're potentially set up for pain again, which makes it a short-term pain solution. So be careful with surgery. I'm not saying that surgery should never, ever be done. I'm just saying that you can't look at it as a long-term fix. You still have to do work to fix the root problem, that muscle imbalance that's putting the bad pressures through your meniscus, to give yourself the best shot at avoiding surgery and not having any knee problems theoretically the rest of your life, as long as you can keep your muscles in the right balance. Number 15 is that meniscus surgery sets up knee osteoarthritis. And we're learning about this from research studies, and we've seen it in people in live cases as well. But the research that I'm referring to is out of Finland, where they've taken two groups of people, both with meniscus tears, none with any other conditions, like they just had a meniscus tear, no other knee problems, and they had an experimental group and a control group. And the experimental group got what's called a sham surgery. I'll tell you about that. And the control group got a normal meniscectomy procedure. So they had a chunk of their meniscus cut out. The sham surgery group got a surgery, but they didn't touch the meniscus. So they went in, they made incisions, they put the person under anesthesia, they did everything like a surgery, except when they got to the part where they were going to cut out the meniscus, they left it there. They didn't touch the meniscus. Then they sewed them all up, just like the control group, the people that got the normal meniscectomy procedure. And what they did is they followed them up for months afterwards, and they found that both groups improved the same in pain and in function. So now they're raising questions saying, do we even need to be doing this meniscectomy procedure? Maybe it's in our head more than it is actually doing something mechanically within the joint. But what makes it even better, what takes it a step further, is they followed up with this group of people, both groups, 2 years and 5 years afterwards in two separate studies, and they found that the group that had the normal traditional meniscectomy procedure where they did cut out a chunk of their meniscus got knee osteoarthritis faster and more often than the group that did not have their meniscus cut out. So this makes us think, I mean, the logical reasoning is maybe that torn meniscus, even though it's torn, is still helping to cushion your knee somehow. Maybe it's still beneficial for you to keep that chunk of meniscus that the surgeon might want to cut out because it's preventing you from developing knee arthritis as fast. I haven't seen any other studies since then, so this is brand new stuff, but I've seen many patients that have had a meniscectomy and they have knee osteoarthritis and they're in their 40s. We usually don't see knee osteoarthritis develop into late 50s or 60s and beyond, but I have to think that them getting that meniscectomy procedure is leading them to get the arthritis at such an early age. The good news is that you can still fix the muscle imbalance even though you got early onset arthritis and still have a great situation, but you just need to be aware of this so that you know more going into the decision on whether or not you want to have surgery for your knee if you have a meniscus tear. Number 16, final point here, is meniscus treatment is a process, not a procedure. Hopefully you've gathered that up to this point, but let me just highlight it and summarize it for you, is there are many steps. It's a process. You have to get your glutes active. You have to make sure you stop doing things that hurt you. You have to consider your foot strength. You have to consider your abdominal strength. You might have to offload early on. There's many steps that you need to go through in order to set your meniscus up to heal naturally and avoid a surgery. A surgery is a procedure. You go in, you don't have to do anything prior, you just have to have a tear. And you get put under anesthesia, you go to sleep, and then the surgeon does their work, and then you wake up and your meniscus is changed afterwards surgically. That's a procedure. And that's not fixing the root problem. That's just cutting a chunk out of tissue, but you still have the root problem there. If you want to have long-lasting relief from a meniscus tear and set yourself up to not develop knee arthritis and worse knee problems like having a knee replacement someday, then you need to fix the root problem, which requires you going through the process of fixing the root muscle imbalance that causes knee arthritis. Now, I've got a program that I developed called the Knee Meniscus Tear Recovery Program. And this program walks you through that whole process. I've outlined everything. It's as if I'm there with you, taking you through the treatment. All you have to do is follow my instructions and see what applies to you and what doesn't. Make adjustments along the way, and you should feel like you're making progress in healing your meniscus and avoiding surgery. Hey, if you're looking for more help with a torn meniscus so that you can avoid having a meniscus surgery, I want you to check out this video right here. It's called the Top 8 Best Treatments for Healing a Torn Meniscus.